Hi everyone, I'm Christine Ramirez and I'm going to discuss about stillbirth. What is stillbirth? Stillbirth is defined as fetal death that occurs after the 20th week of gestation, as opposed to a miscarriage that happens from conception until the 20th week. The baby can die in the uterus as well as during delivery. Next is the signs and symptoms of stillbirth. First is decrease or abnormal baby movement. With the progression of pregnancy, a woman learns the patterns of her baby's movements. Second is unusual discharge or bleeding from the vagina. Any abnormal discharge, especially if it has an odor or color, can be a sign of infection or other complication, and it should be evaluated right away. Leaking fluid from the vagina. Although it is normal to experience light leakage throughout pregnancy, more voluminous amounts of leaking fluid from the vagina might be a sign of abnormalities. Next is the risk reduction for stillbirth. First is quiet addictions to cigarettes, alcohol, and illicit drugs. Second is to prevent infections by avoiding eating raw meat, raw fish, and unpasteurized milk products. And third is to reach a healthy weight prior to getting pregnant. Fourth is to control your pre-existing healthy conditions prior to conceiving. Lastly is have frequent checkups to carefully monitor for signs and symptoms of potential abnormalities. And the effects of stillbirth on the mother generally, there are no physiological consequences of having a stillborn baby. Less than 3% of women are at risk of having a recurrent stillbirth in subsequent pregnancies, and most go on to have healthy pregnancies after suffering from a stillborn. Naturally, losing a baby takes a great emotional toll on the aspiring parents. It is common that women traumatized by this event suffer from depression and have a difficult time coping with their loss.